I'm Dr. Fasika Amdasilase from Ethiopia. I am a surgeon and a surgical gastroenterologist by profession. Currently, I am an associate professor of surgery and head of School of Medicine. The topic I would like to discuss now is about SAFRI, and the title I have given for this brief talk is The Ripple SAFRI Created Reached Ethiopia. During my undergraduate medical education, I have I used to think that there is some problem with the way we were being taught. And then when I joined back for surgery residency, I also was thinking that there is something wrong the way we were being taught. And while I was functioning as an assistant professor of surgery in this college, 5 years back, SAFRI came. SAFRI introduced me for the first time to the discipline that now I am in love with, that is medical education or health professions education. Because of SAFRI, I was able to do my first research and publish it. Then after that, I was able to write 7 manuscripts and publish. This is all because of SAFRI. And then because of SAFRI, I was able to improve my clinical teaching, my lecture provision, my conducting activity of workshops. Now, because of SAFRI, I think I have a different perspective as far as education is concerned. And this ultimately will benefit our students. Clinical teaching is supposed to be opportunistic. Clinical teaching is where the teacher can talk about whatever he or she feels like talking. But recently, because of the educational principles that I encountered during my SAFRI and then I developed afterwards, I knew that clinical teachings can also be improved. They can be made objectives. They can have specific outcomes per session and per course that can be designed, communicated to students, and expect a result. This I have been practicing, and I have found it to be very effective, and students love it. I have done my master's in health professional education following SAFRI. I'm now defending my thesis in July 6, and my thesis is on explorative study on clinical teaching in our medical school. And this study have identified that it's an observation, a non-participant observation, where I observed 24 bedsides and rounds in our medical school. And some of the findings I would like to discuss now. Most teachers during the rounds, they don't do formal introduction to patients. They don't orient students as to what's going to happen in the bedside. They don't state objectives in both bedsides and rounds. So this needs to be improved, and I am planning to work on that so that we have faculty development for teachers, so that they will be able to have common objectives. There should not be difference amongst teachers as far as a specific bedside is concerned. And teachers also should role model professionalism by introducing the team and themselves to the patient rather than going straight forward to the teaching learning activity. Another finding that came out of this study was questioning as a technique is widely used in clinical teaching, but it can be improved. There are points that need to be improved. The questions, instead of being low-level recall type questions, high-level application or analysis type of questions should be employed more and more. And Teachers, after asking, should wait until the student responds. They should give seconds to minutes before they start talking themselves. And even when students fail to answer, it's good, or answered, it's good to ask the other fellow students to comment on what has been answered by a fellow student rather than straightforward, the teacher going straight forward to discuss or to respond to the question he or she has answered. So clinical teaching, it's a very important area that needs to be focused on and improved, because much work has been done worldwide, especially in the Western medical education. But our situation needs a lot of work, because most clinicians, they don't have teaching background, they don't have teaching as a training, not in undergraduate medicine or in postgraduate medicine. So all of them are teachers just because they are clinicians. And a lot has to be done, because the most important thing that a clinician should do first is to bring an attitude change. We should be uncomfortable with the way we are doing, with the way we are teaching our students, the traditional way, the way we were trained. This has to be improved. A lot of discussion, a lot of dialogue has to take place among us, and I think we, the educators, should take the lead role to bring about these necessary changes that we hope to acquire. Thank you for taking your time to listen to this video. I hope I have spoken some issues to you. Until next time, bye bye.